Tramadol, one of the most prescribed painkillers in the world, is famous for its ability to relieve intense pain when other drugs fail. For many patients, it represents quality of life, mobility, and rest. But you should also know that behind this relief lies a dark side: tramadol dependence, dangerous side effects, and even the risk of overdose. Today, we're going to talk about the positive and negative aspects of tramadol, a drug that can be both a great ally and a serious enemy if not used responsibly. Stay until the end of the video and learn everything about this drug. We are the Sibtaj Project. Let's begin. Tramadol is an opioid analgesic. It has a central action and belongs to the group of weak opioids, meaning it is less potent than morphine but stronger than common painkillers like paracetamol or ibuprofen. What does tramadol do to the body when we take it? This will bind to opioid receptors in the central nervous system, blocking pain transmission. Tramadol works by inhibiting the reuptake of serotonin and norepinephrine, which enhances its analgesic effect. As a result, pain is perceived with less intensity, and the patient experiences relief. What is tramadol used for, and what conditions is it indicated for? This drug is indicated for moderate to severe pain in acute or chronic conditions when other analgesics are insufficient to relieve the person's pain. It is commonly used for postoperative pain, traumatic pain referring to fractures and muscle injuries, and cancer pain in patients diagnosed with cancer. Non-cancerous chronic pain, which refers to arthritis, osteoarthritis, lower back pain, and neuropathies. It is also recommended for neuropathic pain in some cases. And what is neuropathic pain? Well, it's a type of chronic pain that develops over a long period of time, caused by an injury or disease that directly affects the central or peripheral nervous system, causing it to send abnormal pain signals despite the absence of obvious tissue damage. Are there side effects when taking tramadol? The answer is yes. Can some side effects or adverse effects be more frequent than others that are more serious? If we focus a bit on the most frequent side effects, the person may experience nausea, vomiting, dizziness, drowsiness, and even constipation. But excessive sweating or dry mouth may also occur. These are among the most frequent and common effects. Meanwhile, there are serious side effects, which are less common but very important to consider. When taking tramadol, a person may experience it. It can cause seizures and respiratory depression if combined with other central nervous system depressants. Furthermore, it can lead to dependence and withdrawal symptoms if discontinued abruptly. What does this mean? It means you shouldn't self-medicate with this drug, as you can develop a dependence on tramadol, and abruptly stopping it can cause serious side effects. We also need to mention serotonin syndrome. This occurs when combined with antidepressants or other drugs that increase serotonin. You might be wondering, what is serotonin syndrome? Well, it's a potentially fatal condition caused by excessive serotonin activity in the central nervous system, generally due to the use of certain medications, a combination of them, or recreational drugs. Symptoms range from mild tremors and diarrhea to severe symptoms such as fever, seizures, and muscle rigidity, which can be fatal. So, be very careful when using this drug without a prescription. What are the contraindications for tramadol use? Under what circumstances are they contraindicated? Who should not take this drug? Well, patients with opioid allergies, to which tramadol belongs, are advised not to take it and to stop taking it immediately, as it can have direct negative effects on their bodies. People with uncontrolled epilepsy are also advised to stop taking tramadol. Patients in a state of alcohol intoxication or intoxication from central nervous system depressants, such as sedatives and hypnotics, are advised to stop taking this drug. We must also exercise great caution during pregnancy and breastfeeding, since tramadol has been verified to cross the placenta, reaching the baby directly, and its use in the first trimester may be associated with an increased risk of malformations. Although the evidence is not conclusive, it is best to avoid it. In the third trimester, or near delivery, it can cause neonatal respiratory depression in the newborn, which means the baby is born with difficulty breathing. The syndrome of unclear, possibly death-related syndrome may also occur. Neonatal withdrawal syndrome, in which the baby will exhibit tremors, irritability, excessive crying, and even feeding problems. If the mother used it for an extended period, she should avoid using this drug later in life. It should only be used during pregnancy if the benefits clearly outweigh the risks and under strict medical supervision. What happens during breastfeeding? Tramadol has been shown to be excreted in breast milk in small amounts. It can cause obsessive sleepiness in the infant, difficulty suckling, and respiratory depression in severe cases. The risk is greater if the mother metabolizes the drug rapidly, meaning she produces more active metabolites in her milk. For these reasons, tramadol use is not recommended during breastfeeding, especially in newborns or premature infants. What happens with tramadol if it interacts with other drugs? Tramadol can interact directly with antidepressants and also with tricyclic antidepressants, which can increase the risk of serotonin syndrome. We mentioned this a moment ago. It can also interact with other opioids or benzodiazepines. This will increase respiratory depression and the risk of deep sedation. And what about carbamazepine? Well, if we combine tramadol with this drug, it can decrease the effectiveness of tramadol itself, that is, its analgesic effect will be reduced. And what about alcohol? Alcohol will potentiate the depressant effects on the central nervous system. That is why the use of this drug with any of the aforementioned medications is not recommended. What forms of tramadol are available? Well, it is available in immediate-release tablets or capsules, such as 50 mg. It is also available in extended-release tablets in 100, 150, 200, and even 300 mg strengths. Tramadol is also available in oral solutions, such as drops or syrups of 100 mg per ml. Injectable ampoules are also available, which can contain 50 mg per milliliter and are administered intramuscularly, intravenously, or subcutaneously. And finally, we have the suppository presentation, which is less common in some countries, but we can find it in 100 mg. A lot of information at this point. Regarding tramadol, we need to know that this drug is not effective for everyone, as tramadol needs to be metabolized in the liver by a specific enzyme to become active. Some people have a genetic variant that prevents them from metabolizing it properly. We call these poor metabolizers. In these individuals, tramadol has almost no effect at all. Conversely, other people metabolize this drug too quickly. We call these ultra-rapid metabolizers. They have a higher risk of serious side effects such as respiratory depression and those already mentioned. Another very important point is that tramadol is on the controlled list in several countries. Although it is prescribed as a common pain reliever in many places, tramadol is considered a controlled opioid in several countries due to its potential for abuse and addiction. In fact, the World Health Organization recommends closely monitoring your overall consumption because cases of dependence have increased in recent years. This is very important information for you to know, as it prevents self-medication. All these medications should always be taken under medical prescription. Finally, we must understand that tramadol has been identified as a drug of abuse among young people, since in various recent reports, tramadol has been used illegally as a recreational drug, especially mixed with alcohol or other depressants. This is extremely dangerous for your health because it multiplies the risk of seizures and coma and can even lead to death. In conclusion, we can say that tramadol is neither good nor bad in itself. It is a powerful medical tool in the right hands. Under professional medical supervision, it can give a patient a life with less pain, but used without control, it can become a silent enemy. That is why no one should ever self-medicate with any drug. Tramadol must be used responsibly. And with that, we come to the end of the video. This is one. Of all the important and relevant drugs worldwide, tramadol has both positive and negative effects on your body. Now that you know about it, I know you'll use it responsibly. If so, I invite you to subscribe. It costs you absolutely nothing to be part of the Sibtaj community. If you liked the video, give it a like so you'll be notified of other great and relevant medical videos. My name is Taj. We are the Sibtaj Project.